questions are being answered, that the myths are being dispelled.
Important answers encouraging entire communities to vaccinate. First at 10, an in-depth look at one of the hardest hit populations by COVID-19 and why some people right here in the metro are so hesitant to get the vaccine. You know, the numbers speak volumes. 145 Latinx Kansas Cityans per 100,000 have lost their lives to COVID-19. Let's put that in perspective as we compare that to 50 white residents per 100,000 deaths. That's all coming to us from Kansas City.
Now, what's the reason for the disparity? Latinx folks asked healthcare workers that question in a virtual roundtable tonight. One of the panelists, Dr. Mario Castro, says there's an issue with access to care in minority communities. He also says Latinos often live in multi-generational households. Once the virus hits one person, it often tends to hit everyone.
We believe that it's likely more social environment than genetic. In that Latinos are often frontline workers in the occupations where, you know, you're elbow to elbow working with each other, working very closely, unfortunately puts you at risk, of course, of COVID-19.
But as the community faces a high risk of COVID-19, there's still a lot of concern surrounding the vaccine. 41 Action News reporter Andres Gutierrez dives into these concerns and the effort to build trust.
A recent poll done by the Kaiser Family Foundation revealed that 6 in 10 Latino adults say they don't have enough information on where to get a COVID-19 vaccine. Locally, there are community and health leaders looking to change that.
Vibrant health is vital for Latinos in Kansas City, Kansas, and surrounding communities in keeping them healthy and during this pandemic informed.
That the questions are being answered, that the myths are being dispelled, and that people have access to that accurate information in a timely manner.
Chief Program Officer Andrea Perdomo Morales often hears patients' fears and concerns over COVID testing and now vaccines.
All of the information that we gather is for our use only, and we do have to provide some of the demographic information to the state, but none of that would be used by ICE or other individuals.
Itself into different symptoms.
She was one of 7 panelists in a bilingual discussion Thursday evening titled Overcoming COVID-19 Together, organized by the Juntos Center for Advancing Latino Health.
To give the Latino community a voice, a window to express their concerns, and for our officials voting Johnson and Wayne County to address them.
Leaders believe some of the myths spreading locally may stem from overseas.
There's also information coming from our Latin countries that sometimes doesn't necessarily align to what we're seeing here in the U.S. A few weeks ago, the president from Venezuela talked about miraculous drops that would cure people who were infected with the virus.
But it has helped that important messages related to COVID-19 are now widely available in multiple languages than they were at the beginning of the pandemic.
We're not trying to persuade anyone to do anything, but informing themselves so they can make an informed decision.
In Kansas City, Kansas, Andres Gutierrez, 41 Action News.